Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing a topic that many people need to broach in order to get anywhere. It's the starting point with getting started with Medicare. It's a bit of a double meaning in the fact that it speaks to a presentation we can use with the public. This is taken from the Centers for Medicare and Medicare Services, Centers for Medicare and Medicaid Services National Training Program, and is compliant for use by agents with the public as well. It is a lengthy webinar or presentation, and I want to warn you ahead of time for that, but we're going to go through the entire piece here and then also use it in segments, much as what you may do in a live or virtual presentation with prospects and clients. You have our contact information on this slide as well, the 1-800-365-8208 number, and our website at premiersmi.com. Obviously, the presentation is being recorded and will be posted on our website at premiersmi.com and also on our YouTube channel. So without further ado, let's begin. What we'll do today is discuss some basics. What's Medicare? What is original Medicare with Parts A and Part B? What are Medicare supplement insurance plans, the Medigap programs? What are the specifics with Medicare drug coverage, Part D programs? How do you deal with and what are Medicare Advantage, Part C plans? Touch a bit upon how Medicare and the health insurance marketplace interact or don't, and speak to some additional information about help programs, assistance programs for people with limited income and resources. We'll touch on some helpful websites for you and speak to the key points to remember from this long presentation and some acronyms that come as part of this segment of our industry. So overall, this should help us compare the parts of Medicare and the coverage options. We should be able to better explain the benefits and costs of the program. We'll be able to compare original Medicare and Medicare Advantage plans in generalities. We'll discuss how Medicare supplement insurance, Medigap plans, and Medicare Advantage plans are different. We'll also describe how the health insurance marketplace and what people nearing Medicare eligibility need to know and how they interact or don't with Medicare. And we will recognize those programs for people with limited income and resources. In each of these categories, we have additional trainings that can help you go further in depth in each of these segments. So to begin, what's Medicare? It's a health insurance program for people 65 or older, or folks under 65 with certain disabilities, most specifically ALS, commonly referred to as Lou Gehrig's disease, and amyotrophic lateral sclerosis. That's as close as I can come to a pronunciation without a waiting period, and any individual of any age that has end-stage renal disease, ESRD. It's important to note that to get Medicare, you must be a United States citizen or lawfully present in the United States and must have resided in the United States for 5 continuous years. The Medicare and You booklet, which we're showing the 2021 version here, is an invaluable piece of information for all of us across the board. Agencies that are responsible for Medicare, well, there are a number of them. There are different programs that handle the enrollment and premiums, and this includes the Social Security Administration, which enrolls most of the people in the Medicare, but there are also a number of people that qualify through the Railroad Retirement Board, the RRB, which enrolls railroad retirees in the Medicare, and the federal employees, the retirees of those systems, are handled by the Office of Personnel Management, the OPM. We also know that CMS, the Centers for Medicare and Medicaid Services, administer the Medicare program. So there are different parts of Medicare. Part A, the hospitalization coverage, Part B, the medical coverage, and Part D, the drug coverage. Part C we'll talk about as well. When you look at Medicare options for someone becoming eligible for Medicare, and for those of us discussing these programs, we look at Part A, the hospitalization, we look at Part B, the medical, we look at the optional Part D program that help with drug costs, And then we also look at some of the supplemental coverages that are out there that can aid in the costs that aren't fully funded or paid for by Medicare. And these include the standardized, modernized Medicare supplement programs, the Medigap plans, or in certain circumstances, folks who get coverage elsewhere from a former employer or union or Medicaid or other sources. It's important to note that Medicare supplement insurance, Medigap policies only work with original Medicare. They do not work with the Medicare Advantage plans, which combine the Medicare Part A and Part B coverages, and most of the programs integrate the Part D prescription drug coverages as well. They offer some additional benefits, extra benefits that may vary from market to market, and they can also include programs that help drive lower out-of-pocket costs. So, specifics. When you look at original Medicare versus Medicare Advantage, let's speak to the doctor and hospital choices that are available under these programs. With original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. And in most cases, you don't need a referral to see a specialist. That caveat is put in there because many of the specialists require a referral from another physician for you to see them, not an insurance requirement. With the Medicare Advantage programs, the Part C programs, in many cases, these are network-based programs. So you'll need to use doctors and other providers who are in the plan's network for non-emergency care. Some plans offer non-emergency coverage out of network, but they're typically at a higher cost. Those may be the ones that are set on a POS or PFS type of situation. And in many cases, you may need to get a referral to see a specialist that is part of the network. When you look at the cost between these programs, with original Medicare, for Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your annual deductible. This is called coinsurance. You pay a premium, a monthly payment for Part B. If you choose to join a Medicare drug plan, you'll pay that premium separately for that Medicare drug coverage, the Part D programs. Original Medicare does not have a yearly limit on what you pay out of pocket unless you have supplemental coverage like Medigap, Medicare supplement insurance. So no MOOP, no maximum out of pocket. You can get Medigap to help pay for that remaining out of pocket costs like the coinsurance, the deductibles in certain circumstances, or you can use coverage from a former employer or union or Medicaid or another type of coverage that you may qualify for, like the VA, totally separate from Medicare as well. When you look at Medicare Advantage programs, the out-of-pocket costs vary. The plans may have different out-of-pocket costs for certain services, depending upon the area, depending upon the carrier that's out there. And they can change year to year. You do still pay the monthly Part B premium and may also have an additional plan premium as well. Plans that have a zero premium and may help pay all of the Part B premiums are available as well. And most plans include that integrated Medicare drug coverage, that Part D coverage. These plans do have a yearly limit on what you pay out of pocket for services Part A and Part B cover. Once you reach that plan limit, you pay nothing for those services for Part A and Part B for the rest of that calendar year. It's important to note, you have a Medicare Advantage plan, you can't buy and don't need Medigap coverages. There are other ancillary coverages you may investigate for certain types of benefit, but it doesn't cover deductibles and coinsurance per se. So when you look at the coverages between these two programs, with original Medicare covers most medically necessary services and supplies in the hospitals, doctor's offices, and in other healthcare facilities. Original Medicare does not cover certain benefits like eye exams, most dental care, routine exams, things of that nature. You can join that separate Medicare drug plan to get help with the Medicare or the medical cost of the prescriptions, that drug coverage through Part D. And in most cases, you don't have to get a service or supply approved ahead of time for original Medicare to cover it. With Medicare Advantage, the Part C programs, the plans must cover all of the medically necessary services that original Medicare covers. And most plans do offer additional benefits, extra benefits that original Medicare doesn't cover, like routine exams and vision, hearing, dental services, and other benefits in most circumstances. Medicare drug coverage, Part D, those coverages are included in most of the plans. And in most type of Medicare Advantage plans, you can't go to a separate and use a separate Medicare drug plan. So you have to use the medication coverage that's integrated into that MAPD, Medicare Advantage prescription drug plan, and not use a separate standalone program. And those are programs that you would buy through the system. And in some cases, you have to get a service or a supply approved ahead of time for the plan to cover it. When you look at foreign travel, for those who go outside the United States, original Medicare generally doesn't cover care outside the U.S. You may be able to buy a Med Sup plan, a Medicare Supplement Insurance Program, a Medigap Policy that covers care outside the U.S. to one degree or another. Medicare Advantage plans generally don't cover care outside the U.S., but some plans may offer a supplemental benefit that covers the emergency or urgently needed care services when traveling outside the U.S. That amount may vary from plan to plan as well. When we look at how you become involved as a beneficiary in Medicare Parts A and B, and once again, we've got a piece on here that says 2021, same thing for 2022. There's automatic enrollment for people who get Social Security benefits or the railroad benefits. And those folks receive a get ready for Medicare package. This is mailed 3 months before the age of 65 or during the 25th month of disability benefits. And it includes the Medicare card of that beneficiary. When you get that card as a beneficiary, you can keep it to accept the Part B coverage, or if you want to refuse the optional medical coverage, the Part B coverage, there are instructions here. And you can get a replacement card by visiting the Medicare.gov account service to log into your own secure Medicare account and print an official copy. Or you can call 1-800-Medicare, 1-800-633-4227, and receive a card that way as well. Very small percentage of people actually decline Medicare Part B, but it is possible. And for the folks that, pardon me, I'm seeing some things here with a challenge on the PowerPoint. For folks that must take action to enroll in the Medicare program, if you're not automatically enrolled in Part A and Part B, you need to enroll through Social Security by visiting the Social Security website or calling Social Security through their toll-free number at 1-800-772-1213. Or if you've retired from a railroad, enroll with the railroad board, and that is done through the local office at 1-877-772-5772. And it's important to note that the age for full Social Security retirement benefits is increasing. Medicare eligibility age is still 65, but to get full Social Security benefits, well, that's getting older. For those on the tail end of the baby boomer generation, we're seeing it push into 67 and above. When can you sign up for Medicare? Well, if you don't already have Medicare, there are 3 important periods to utilize to get that coverage. There's the initial enrollment period, the IEP. There are special enrollment periods, an SEP for certain circumstances, and the general enrollment period, the GEP, for folks looking to access Medicare benefits. If you already have Medicare and you look to make changes to how you get your coverage, you can do that through different enrollment periods throughout the year, utilizing the open enrollment period, the OEP, the Medicare Advantage OEP. You'll see the open enrollment period here through a lot of publications noted as the annual election period, the AEP. And then there are different special election periods that allow an individual to change their coverage anytime in the year if they qualify for one of those special election periods. And one of them that is very well noted is the 5-star enrollment period, which is set up for programs that have the highest ranking garnered to them by the government. So when we look at that IEP, that initial enrollment period, we're looking at a 7-month period. So we're looking at 3 months before the month the individual turns 65, the month of their birthday, and 3 months after they turn 65. This gives us some opportunity to help people across the board and make certain that we are not losing our opportunity to get the coverage when we're first eligible. Because during that IEP, we enroll or join Part A, Part B. We can enroll in Medicare Advantage plans. We can enroll in Part D programs, and we can buy Medigap policies if we have Part A and Part B, but not Medicare Advantage. The Medicare OEP lasts 6 months from when you're both 65 and have Part B. So there are a number of individuals that will delay picking up Medicare Part B because they may be still working with coverage or for one reason or another. And so that may change the eligibility of time period for their OEP. When we look at those special election periods, there are a number of programs that come into play. And this is a opportunity for folks who didn't take coverage when they were first eligible or did and dropped it or whatever it happens to be. But it's an 8-month period when the individual can enroll in Part A and Part B, and using that SEP, they can pick up those optional coverages, such as the Medicare Advantage plans, if they have Part A and B, or the Part D programs, the drug programs, if they have Part A and or Part B. The individual must have 6 months from the Part B effective date, a period there where they can purchase a Medigap policy if they have Part A and Part B without underwriting. And keep in mind, this is important because utilizing the SEP or enrolling when an individual is first eligible, it eliminates the possibility of late enrollment penalties, which are there for folks that don't follow the timetable. So when we look at the general election period, the GEP, this is one where a person that hasn't had Medicare, qualified for it in the past, has an opportunity beginning in the 1st of January and ending at the end of March to pick up Medicare coverages, and those coverages will begin on July 1st. Depending upon why they didn't have coverage when they were first eligible, they may or may not have late enrollment penalties, and they can get substantial depending upon the length of time in which that individual did not have coverage. That 3-month period each year during which the person can sign up enables them to pick up Part A for folks that don't have enough quarters. They can buy into that program and the Part D coverage. If the individual signs up for Medicare during the GEP in that 3-month period, from April 1st to June 30th, you can join the Medicare Advantage if you have Part A and Part B and the Part D. If you don't, well, you got to have those underlying coverages. The open enrollment period, OEP for people in Medicare, this is referred to by most of the insurance carriers as the annual election period, and by Medicare in certain presentations as well as AEP, annual election period. This is a 7-week period each year where the individual can enroll in, disenroll, or switch Medicare Advantage plans or Medicare drug plans without underwriting, without any hiccups along the way. And this is a time where beneficiaries are urged to review their health and drug plan choices because these plans can and do change year over year. In that circumstance, the enrollment during that 7-week period becomes effective January 1st the following year. During this time period as well, you can make additional coverages as we roll past the 1st of the year into the OEP period. It is not a time frame where agents or companies are enabled to market that option, but people can be made aware of it. Different counseling services and the government kicks out some information on it. But during this time period, January, February, and March, if an individual is in a Medicare Advantage plan with or without drug coverage, they can switch to another Medicare Advantage drug plan with or without drug coverage. You can also, at this time period, as a beneficiary, drop the Medicare Advantage plan and return to original Medicare and pick up a Medicare drug plan at that time. However, the beneficiary cannot make these changes. They can't switch from original Medicare to a Medicare Advantage plan. It's not a continuation of that 7-week period. They cannot join a prescription drug plan if they're on original Medicare. You'll note in the caveat above, if someone's on a Medicare Advantage only plan, they can switch to an MAPD plan and pick up coverage. And the person cannot switch from one Medicare drug plan to another if they're in original Medicare. They can if they already have that coverage. It's important to note that during this 3-month period, the beneficiary can make only one change during that time period, utilizing the OEP option. If they qualify for a different special election period, that's a different animal. But in this circumstance, using OEP, it's a one-time switch. The 5-star special enrollment period is an opportunity for a beneficiary to switch to a 5-star Medicare Advantage plan with or without drug coverage or drug plan if they're available in their service area. They're not everywhere across the country. And it gives us the opportunity to use this SEP once per year during the December 8th to November 30th of the following year's time period. That new plan will begin the first day of the month after they have enrolled, and these star ratings are given once a year. They're assigned in October, are effective January 1st, and the government site at Medicare.gov Plan Compare enables us to look at those star ratings and see if there are eligible plans in our service area. Other commonly used Medicare special election periods, lovingly referred to as SEPs. Some of the most common ones, well, if you move out of your plan service area, or if you have Medicare and Medicaid or qualify for low-income subsidy, LIS, extra help programs, you have a once per calendar quarter during the first 9 months of the year that you can change plans. You can also change if you lose, or make a change in your extra help or Medicaid status, or if your plan leaves Medicare or reduces its service area, or if you enter, live at, or leave a long-term care facility like a nursing home, or if you've been sent a retroactive notice of Medicare entitlement, happens periodically, or if you leave or lose employer or union coverage voluntarily or involuntarily. There are a number of other special, exceptional circumstances as well. When we look at some of the core coverages of Medicare, let's discuss Medicare Part A, hospital coverage, and Medicare Part B, the medical insurance piece. When we look at Part A, hospital insurance, what it covers, it helps cover medically necessary inpatient care in a hospital. That includes a semi-private room, meals, general nursing, drugs, including methadone to treat an opioid use disorder, and other hospital services and supplies as part of your inpatient treatment. This includes care that people get in acute care hospitals, critical access hospitals, inpatient rehab facilities, long-term care hospitals, psychiatric care and inpatient psychiatric facilities. There's a lifetime of 190-day limit in a freestanding psychiatric hospital, and inpatient care for qualifying clinical research studies. Easy for me to say. You also get coverage for inpatient care in a skilled nursing facility, and that's a SNF referred to sometimes. And this is with traditional Medicare after a related 3-day inpatient hospital stay if the individual meets that overall criteria. When you look at Part A additional coverages, it takes care of blood administered during an inpatient stay, hospice care, home health care, inpatient care, and a religious non-medical health care institution as well. How do you pay for Part A? Well, most people don't pay a premium for Part A. If you, as a beneficiary, or the beneficiary's spouse has paid federal insurance contributions, FICA, those taxes for at least 10 years. And if you paid those FICA taxes for less than 10 years, you can pay a monthly premium to get the Part A coverage. And you may have a penalty if you don't enroll when you're first eligible for Part A if you have to buy it. Those monthly premiums may go up 10%. And you'll have to pay that higher premium for twice the number of years that you could have had Part A but didn't sign up. So it can be fairly substantial. When you look at Part A, what you pay in original Medicare, this is crucial for us because it helps us determine whether our individual circumstances as a Medicare beneficiary prompts us to get additional coverage one way or another. The hospital stay has a deductible for each benefit period. It's $1,484 each time an individual goes into a hospital and has coverages dependent upon how long the individual is in the hospital. So for the first 60 days in a hospital, there's no co-insurance for the benefit period that is with that stay. For days 61 to 90, there's a co-insurance per day each benefit period of $389. If the individual's in there a longer time, days 91 and above, that co-insurance goes to $778 per day for each lifetime reserve day after day 91. And this is a time period, a benefit period. It's limited for 60 days over the beneficiary's lifetime. If you go past that lifetime reserve days, the beneficiary is responsible for all the costs in that hospital. It's important to note that private duty nursing, a television, or a phone in the room, well, you pay for it as a beneficiary. You also pay for a private room unless it's medically necessary. When you look at how mental health inpatient stays are covered, it has a $1,556 deductible for each benefit period. And for days 1 through 60, much like the medical stay, it's zero co-insurance per day. Days 61 through 90, it's that $389 per day. Days 91 and beyond, that's $778 per lifetime reserve day with that 60 days over the lifetime. Beyond lifetime reserve days, beneficiary is responsible for all costs. Keep in mind, there's no maximum out of pocket with original Medicare. The individual also pays 20% of the Medicare approved amount for mental health services you get from doctors and other providers while you are a hospital inpatient. It's important to note, once again, there's no limit to the number of benefit periods you can have when you have mental health care in a general hospital. You can also have multiple benefit periods when you get care in a psychiatric hospital. So remember, however, that is limited to that lifetime benefit of 190 days. Some additional costs that come with original Medicare, when you look at the skilled nursing facility stays, those SNF stays, for days 1 through 20, Medicare covers it completely. Days 21 through 100, there's a co-insurance of $194.50 per day of each benefit period, and days 101 and beyond, all cost. That's why short-term care and long-term care policies are important. When you speak to home health care, it's $0 for those services, but the individual does pay 20% of the Medicare approved amount for durable medical equipment, DME. When you look at hospice care, it's covered with no out-of-pocket costs for the beneficiary, but they may need to make a co-payment of no more than $5 for each drug or similar products for pain relief or symptom control while the beneficiary is at home. In the rare case, if the drug isn't covered by the hospice benefit, your hospice provider should contact the Medicare drug plan to see if it's covered there under the Part D Medicare drug coverage. The beneficiary may also need to pay 5% of the Medicare approved amount for inpatient respite care. And Medicare doesn't cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. Blood. If the hospital gets it from a blood bank, there's no charge. At no charge, you have no charge. But if the hospital has to buy blood for you, you must either pay the hospital costs for the first 3 units of blood you get in the calendar year, or have the blood donated by you or someone else. Many times an individual will donate blood before they go into the hospital, or have done so in the past, or they have family members or friends that do so and donate it for their use. Benefit periods. We talked about how the dollar costs are associated with each benefit period. Well, these are programs that measure the use of inpatient hospital and SNF care, and they begin the day the beneficiary first gets inpatient care in the hospital or the SNF, and it ends when not in the hospital or released from the skilled care in that skilled nursing facility 60 days in a row. The Part A deductible, it applies for each benefit period, and there's no limit to the number of benefit periods you can have. You can have multiple benefit periods that span calendar years or within a single year where it still applies. So it's a major concern and can be very expensive. Decision. Do you need to sign up for Part A? Well, consider the fact that it's free for most people and you can pay for it if your work history isn't significant. And you got to watch for that delay, the penalty if you do delay enrollment. But talk to the benefits administrator if you or your spouse are actively working and covered by an employer plan. If they don't know, call Medicare or a qualified insurance agent to get that information. It's important to note to avoid the Internal Revenue Service, IRS tax penalties, you need to be also aware of the fact you need to stop contributions to your health savings account, the HSA, before Medicare starts. Part B coverages. Well, Part B covers medically necessary services such as doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, DME. These are things such as walkers and wheelchairs, hospital beds, diabetic testing equipment and supplies, preventative services like flu shots and a yearly wellness visit, home health care in certain circumstances, medically necessary outpatient physical and occupational therapy, and speech language pathology services as well, and outpatient mental health care services. Those preventative services, there's a ton of them. Abdominal aortic aneurysm screening, alcohol misuse screening and counseling, bone mass measurement, bone density tests, breast cancer screening, mammograms, cardiovascular disease, behavioral therapy, cardiovascular disease screenings, cervical and vaginal cancer screenings, colorectal cancer screenings, counseling to prevent tobacco use and tobacco-caused disease, depression screening, diabetes prevention programs, diabetes screenings, diabetes self-management training, flu shots, glaucoma test, hepatitis B shots, hepatitis B virus infection screening, hepatitis C screening tests, HIV, human immunodeficiency virus screenings, lung cancer screenings, medical nutrition therapy services, obesity screening and counseling, pneumococcal shots, prostate cancer screenings, sexually transmitted infection screening and counseling, the Welcome to Medicare preventative visit, and the yearly wellness visit. What's not covered by Part A and Part B, and this is very important because many people assume these coverages come with Medicare, but they include most dental care, eye examinations related to prescribing glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, acupuncture and other types of acupuncture like dry needling for any condition other than chronic low back pain, hearing aids and exams for fitting them, long-term care, concierge care. Boy, I mispronounce it every time. Pardon me. These are retainer-based medicine, boutique medicine, platinum practice, or direct care programs. And they might be covered if you have other coverages such as Medicaid or a Medicare Advantage plan that specifically covers these services. Or it may predicate the investigation of other coverage for these needs. What do you pay? Well, in 2022, the Part B monthly premium, the standard premium is 170.10. The individuals may have to pay a higher amount depending upon their income. We have that detailed in the next slide. Some people who get Social Security benefits may pay less than this amount due to the statutory hold harmless provision from in the past as to when they became eligible and freezing the amount from in the past. And the premiums may be higher if an individual did not choose Part B when they became first eligible. That premium can go up 10% for each 12-month period that the beneficiary could have had Part B but didn't take it. So that can add up. This is the infamous Irma chart, the income-related monthly adjustment amount for 2022. And this lays out what an individual at a certain income level as an individual or filing jointly pays for those coverages. So as the income goes up, so does the premium for the Part B. And that's important to note. The median income for a Medicare beneficiary, the last detail I have was $26,200. So you don't necessarily run into a ton of people, and there aren't a ton of people that have this, but those that do, you'll need to know. What you pay in original Medicare for 2022 for Part B, well, there's a $233 yearly deductible. Unlike the Part A deductible, which is per stay, this is an annual deductible. And this coinsurance is a 20% coinsurance for most covered services like doctor services, some preventative services, if that provider accepts assignment. It's $0 for most preventative services. It's a 20% coinsurance for outpatient mental health services and copayments for a hospital outpatient service. The decision to keep or sign up for Part B, well, most people consider that monthly premium. It's usually deducted from Social Security or the railroad benefits, and the amount, as we mentioned, depends on income. It may supplement employer coverages as well, depending on how many people are in your group. That's important. So you need to contact your benefits administrator to understand the impact on the employer plan. And if you don't have other coverage, declining Part B will mean you don't have full coverage. And sometimes you must have it, plain and simple. The periods that are where there's a necessity to have Part A and Part B, well, if you want to buy a Medicare supplement plan, a Medigap policy, you need it. If you want to join a Medicare Advantage plan, you need it. If you're eligible for TRICARE for Life or Civilian Health and Medical Program for the Department of Veteran Affairs, CHAMP VA, you got to have it. And if your employee coverage requires you to have it, where that group has less than 20 employees, you need to talk to your employer or union benefits administrator to see if that applies for you. Most circumstances, you know how many fellow employees you have, but you may not. So speak to your administrator of those benefits. It's important to note that Veteran Affairs VA benefits are separate from Medicare. With VA benefits, you may choose to not enroll in Part B, but you will pay a penalty if you don't sign up for Part B during your initial enrollment period and later enroll. Details are available at the va.gov website. If you have VA coverage, you won't be eligible to enroll into Part B using a SEP. So let's look at some of the options that you have for additional coverages with Medicare. It's important to note that no one option is right for everyone. So we need to look at the details of the different opportunities you have to cover that financial shortfall in traditional Medicare. So looking at Medicare supplement insurance to begin with, the Medigap policies. These are programs that are sold by private insurance companies. They fill the gap in original Medicare coverages, those deductibles, coinsurance, and copayments to one degree or another. And each standardized Medigap policy under the same plan letter, they must offer the same basic benefits no matter what company offers it, who sells it, and they may vary in costs, cost being premiums. These plans are different in 3 specific states. So if you live in Minnesota, Massachusetts, or Wisconsin, the standardized programs there aren't the same as they are in the other 47 states. This gives you a detail of the coverages by plan type for Medicare supplement insurance Medigap programs. And so it lays out the different programs that are available by plan type, labeled by letter, and what they cover, these notable benefits, how they cover them. It's important to note that plans F and G also offer a high deductible plan in some states. And it's important to note that Plan F isn't available to people new to Medicare on or after January 1st, 2020. If the beneficiary gets high deductible option, they must pay the Medicare covered cost, coinsurance, copayments, deductibles, up to the deductible amount of $2,370 in 2021, higher than that in 2022 before the policy pays anything. And you must also pay a separate deductible, $250 a year, for foreign travel emergency services. Plans K and L show how much they'll pay for approved services once you meet your out-of-pocket yearly limit and your Part B deductible. And after you meet these amounts, the plan will pay 100% of your costs for approved services for the rest of the calendar year. Plan N pays 100% of the Part B coinsurance, except for a copayment of up to $20 for some office visits and up to a $50 copayment for emergency room visits that don't result in an inpatient admission. So, do you need a Medigap policy? Consider it only works with original Medicare, and if you have other supplemental coverage, like from an employer, you may not need Medigap policy. And can you afford the deductibles and coinsurance on some of the different plan types? And what does the monthly Medigap premium cost, and how does that affect your budget? Can you handle it? Important to note. When's the best time to buy a Medigap policy? Well, the Medigap open enrollment period, the OEP, begins the month that you're 65 or older and enrolled in Part B. You must also have that Part A coverage. It lasts 6 months minimum, might be longer in your state of residence, and you have protections under the program. During the Medigap OEP, companies cannot refuse to sell you any Medigap policy they offer in your state. They cannot make you wait for coverage. They cannot charge you more because of a past or present health program. You can also buy a Medigap policy whenever a company agrees to sell you one. There may be restrictions like medical underwriting or waiting period for pre-existing conditions in certain states. Certain states have certain requirements and certain additional protection. How do you buy them? Well, you need to decide which Medigap policy best suits your needs, plans A through N, with the benefits that you need. You can compare the plans by computer or on phone with an insurance agent. You can go to Medicare.gov, Medigap Supplemental Insurance Plans, and use the Medigap comparison tool. You can call 1-800-Medicare. You can find out when insurance companies sell Medigap policies in your state, because not every insurance company sells in all 50. So you would need to contact your state health insurance assistance program, SHIP program, or visit shipacenter.org, your state insurance board, or visit an insurance agent or Medicare.gov, Medigap Supplemental Insurance Plans. And you also need to see how your state extends protections for those under a disability. Keep in mind, 15% of the Medicare population is under the age of 65, accessing Medicare benefits because of a disability. They may be eligible for only certain programs, so that's important to note. It's important then to call the insurance companies, shop around for a best plan at a price you can afford. So keep in mind the standard benefits are the same. Every company, what varies, cost. And once you choose the insurance company in the Medigap policy, you apply for that policy. You need to apply for it. It's not automatic. When we look at how you get Medicare drug coverage, the Medicare Part D programs, these are an optional benefit available to all people with Medicare. They're run by private insurance companies that contract with Medicare. They're vetted through the government. They're provided through Medicare drug plans, also known as PDPs, and they work with original Medicare. Medicare Advantage plans with drug coverages are also known as MAPDs, Medicare Advantage prescription drug plans. And there are opportunities to pick up this coverage through other Medicare health programs as well. We'll discuss that later. How do these plans work? Well, keep in mind it's optional. You can choose a plan and join. You might have to pay a lifetime penalty if you join late in most circumstances. It's an individual decision too. So a husband and wife must choose a plan on their own. It's not bundled. These plans do have formularies. These are lists of covered drugs, and they must include a range of drugs in each category. They are subject to change. You're notified ahead of time of a change in a formulary, and your out-of-pocket cost could be less if you use a preferred pharmacy with certain PDP programs. If you have limited income and resources, there's the extra help, that LIS program, to help pay Part D cost. These costs do vary by plan, and most people will pay a monthly premium, which varies by plan and income. They can pay a yearly deductible if applicable. There are co-insurance and co-payments in some of the programs, and the percentage of cost, well, in the coverage gap, begins at $4,430 of actual cost of out-of-pocket spending before that coverage gap of sorts kicks in. There are very minimal amounts that an individual is responsible for once they enter catastrophic coverage. And this is after spending $7,030 out of pocket during that annual time period, and that catastrophic coverage is automatic thereafter. Once again, you have the income-related monthly adjustment amount, that IRMA amount, and gee, this is saying 2021, but for illustration purposes, well, as your income goes up, so does the cost of your drug coverage. So the premium of the plan, your plan premium, there's a surcharge based on your income as well. The late enrollment penalty for Part D, this is an amount you have to pay if you waited to enroll past your initial eligibility period. There are certain eligibility exceptions for this, like if you have creditable coverage for drugs elsewhere, or you qualify for extra help. If you have that penalty and then you qualify for extra help, it'll take care of that penalty too. A really nice extra perk for LIS. You'll pay that penalty for as long as you have coverage, and it's 1% of each full month where the individual is eligible and without creditable drug coverage. So 1% per month of the national average of the cost of a Part D program. You need to multiply that percentage by the base beneficiary amount, which is $33.37 in 2022. That's remained pretty stable over the years too, by the way. That amount can change per year, and it does somewhat, but we don't see or haven't seen large jumps or declines in that average cost. Certain cost considerations, well, most people who pick up a Part D plan, they pay a monthly premium, and if an individual has an higher income, you have that additional surcharge, that paying more for that drug coverage. You'll also pay an extra amount in addition to your plan premium, that YPP that we saw, which is sometimes called the Part D IRMA program, if your income is above a certain amount individually or as a couple filing jointly. These plans do have formularies. Remember, that's that drug list. And you need to make certain that the plan covers the drugs you need. And if you use a preferred pharmacy, does it affect that cost? Keep in mind that that formulary can change year to year, and the drugs on that formulary can change tiers within that plan as well. That's why doing an annual review of your drug coverage is paramount to your financial stability when you're on Medicare. So when you look at these programs, you can choose a plan and join. You might have to pay that lifetime penalty if you join later and didn't have the credible coverage. There's a 63-day gap of leniency on it. Costs do vary by plan. That extra help program to pay Part D cost can be very helpful. And in order to be eligible for that, you have to have limited income and resources as well. Who can join Part D? Well, you got to have Medicare Part A, that hospital coverage, and or Part B, the medical coverage, to join the Medicare drug plan, those PDPs. You must have Part A and Part B to join the Medicare Advantage plans with drug coverage, another way you have that coverage. And you must have Part A and Part B, or only Part B, to join the Medicare cost plan with Part D coverages. You don't see very many cost plans left across the country, mostly in more rural areas. You must live in the planned service area. You can't be incarcerated. You can't be unlawfully present in the United States, and you can't live outside the United States to have the coverage. And you must join the plan to get the drug coverage in most cases. It's not automatic. It's an enrollment process, individually based. And when can you enroll in a Part D plan? Well, during that 7-month initial enrollment period, your IEP, or during the yearly open enrollment period, the annual election period, which is October 15th through December 7th of every year, where the coverage begins on January 1st. If you get Part B for the first time during a general election period, that GEP, you can join a Part D plan from April 1st to June 1st with the coverage starting on July 1st when your Part B comes effective. You may be able to join at other times, like if you're in a Medicare Advantage plan on January 1st and you opt out of that plan during the OEP during January, February, and March, or if you're new to Medicare and enrolled in a Medicare Advantage plan during your IEP, you can make a change during the first 3 months you have Medicare, or you may qualify for a special election period, a SEP, or there is, of course, the 5-star SEP that is out there as well. When you look to choose a Part D plan, you can compare plans by computer or phone. You can find health and drug plans at Medicare.gov and Plan Compare, the plan finder. You can call Medicare at 1-800-633-4227, or you can contact your SHIP at the shiptacenter.org place. And in order, well, of course, there are insurance agents that'll help you too. You can join a Part D plan by enrolling at the government site or through a telephonic procedure with 1-800-MEDICARE, or enroll on the plan's website or call the plan. You can complete a paper application. I wouldn't do that. It slows the process down. You might miss something. You might not be able to read your handwriting, yada, yada, yada. And the plan will then notify you if they've accepted or denied your application. And you can't be denied on health conditions or the drugs that you take. You can, of course, seek the counsel of a certified insurance agent to help you here as well. Now, do you want to enroll in the programs? You need to consider, if you have creditable drug coverage, will it pay at least as much as the standard drug coverage or the coverage that you feel might be in your best interest? Will you or your spouse or dependents lose your health coverage if you enroll in a Medicare drug plan? An important consideration. How do your out-of-pocket drug costs compare to out-of-drug costs with a Medicare drug plan? Taking medications, is that a good consideration? You want to enroll in a cheap plan just to avoid the penalty, whatever the case may be. And keep in mind, how do your drug costs change if you get extra help with your Medicare drug plans and the costs that come with them? If you don't have credible drug coverage, later enrollment may mean you'll pay a penalty. And if you go 63 or more days in a row without credible coverage, well, that's your grace period. You're going to pay a penalty thereafter. Let's look at another option to cover some of those gaps in traditional Medicare, and those are the Part C programs, the Medicare Advantage plans. These are programs that bundle the services together. They include Medicare Part A and Part B coverages. Most plans include the Part D drug coverages. Many of them have extra benefits to one degree or another, and they may help lower out-of-pocket cost. Now, a Medicare Advantage plan is another way to get the coverages all together. It's offered by Medicare-approved private companies that must follow rules set by Medicare. They're vetted and investigated by the country's CMS program. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A and Part B coverage from the Medicare Advantage plan, not original Medicare. So they're covering the claims, not original Medicare. In most cases, you'll need to use healthcare providers who participate in the plan's network. Now, some plans will offer out-of-network coverage as well, but in order to minimize cost, if it's a network-based program, you need to use network-based providers. Keep in mind, and sometimes people will look past that, that goes beyond doctors and hospitals. That includes all care providers who bill the government for their services. So home health care coverage, DME coverage, those are also companies or services that need to be part of the network as well. How these plans work: if you're in one of these plans, you're still with Medicare with all the rights and protections, additional protections for appealing services and that sort of programs. It does enable you to get all the coverages that are covered by Part A and Part B of traditional Medicare, and you may choose a plan that includes drug coverage. Keep in mind, if you don't choose a Medicare Advantage plan with drug coverage, that means you're opting out of drug coverage. And unless you have coverage through a retirement plan or maybe through the VA or another circumstance, you pick it up later, you're going to pay the penalty. These are programs that vary from plan to plan within the same carrier, and most certainly from carrier to carrier, so you can be charged different out-of-pocket costs. You cannot be charged more than original Medicare for certain services, like chemotherapy, dialysis, or skilled nursing facility, that's SNF care. You may choose a plan with extra benefits like vision, dental, fitness, wellness benefits, a number of other benefits, and there is a yearly limit on your out-of-pocket cost. Folks will speak to you about MOOP, maximum out-of-pocket. That's the max you would pay per year with one of these programs. Each of these plans have a service area in which the enrollees must live, and the beneficiary or provider acting on your behalf can request to see if an item of service will be covered by the plan in advance. Prior authorization, called an organization determination. You need to call your plan for certain pieces of additional information on such services. Medicare pays a fixed amount for your coverage each month for the companies that are offering Medicare Advantage plans. So no matter what they tell you on a television commercial, it's not free. It's paid for by Medicare. And each plan can have different rules on how you access services, and these rules can change each year. Hospice care is covered by these plans, but it is also bringing in original Medicare for these services. When can you enroll? Different time periods. The IEP, that initial enrollment period, begins 3 months before the month you turn 65, includes your birthday month, and then 3 months after the month in which you turn 65. So you got a 7-month period in order to make a selection. During the general election period, the GEP, if you have Part A and enroll in Part A enroll in Part B during a GEP, you can enroll in that Medicare Advantage plan from April 1st to June 30th for an effective date of July 1st. So you don't miss out on any time that you're eligible. You have a number of special election periods, SEPs, if you, in these specific circumstances, move out of the plan service area, have or lose Medicaid or extra help, move in or out of an institution like a skilled nursing facility or long-term care hospital, or have a 5-star program available in your area, and that's that day from the day after the annual election period ends on December 7th and goes through November 30th of the next year. And that 5-star SEP allows a change from a Medicare Advantage plan or Medicare cost plan that has switch to that has that 5-star overall star rating. The annual OEP, AEP for October 15th through December 7th is the time period. You also have that OEP during the months of January, February, and March, where you can make some changes effective the first of the month after, where the beneficiary has to already be enrolled in a Medicare Advantage plan during those first 3 months of the year and switch to another Medicare Advantage plan with or without coverage, or drop that Medicare Advantage plan, return to original Medicare, and can pick up a PDP at that time. If the individual is new to Medicare and you're enrolled in a Medicare Advantage plan during that individual's IEP, because at different times of the year, you make a change within the first 3 months in which the individual has Medicare. It's important to note that if you drop a Medicare supplement insurance Medigap policy to join a Medicare Advantage plan, you may not be able to get it back because you may be required to undergo underwriting to pick up another MedSup program. How do you find these programs and enroll? Well, you can find them on the Plan Finder at Medicare.gov. You can visit plan websites to see if you can join online. You can fill out a paper application. Plans are still happy to send you that detail. You can contact that company, mail it, fill it out, and mail it back to the plan. All plans must offer that option because not everybody has computers. Or you can call the plan to enroll, or you can call Medicare to enroll, or you can use an insurance agent that is certified for those programs. Should you join a Medicare Advantage plan? Well, consider. You got to have A and B to join. And if the plan offers additional benefits, those extra benefits, in addition to original Medicare benefits, and if you need to pay extra to get them, that's a consideration. How valuable are those extra benefits? Some plans may require you to use a network. You may be required to have a referral to see a specialist. You've got to pay your Part B premium and the monthly plan premium if applicable, because the large number of these plans do not have a monthly premium, but you still have to pay your Part B premium. And you can only join or leave during certain time periods, and it does not work with Medigap policies. We've said that a number of times. It does not. Can you join a Medicare Advantage plan if you have end-stage renal disease? This is a recent change. You can enroll in a Medicare Advantage plan or a Medicare Advantage plan with drug coverage during open enrollment period for these programs. And the Medicare Advantage plan must cover all services that original Medicare covers. Your cost, rights, protections, and or choices of where you get your care might be different, and you may be able to get those extra benefits like the vision, hearing, dental, other extras that are available. If you have a Medicare Advantage plan during open enrollment that change your mind, you can switch back to original Medicare, change to a different original or to a different Medicare Advantage plan during that OEP. How are Medicare, or pardon me, how are Medigap policies and Medicare Advantage plans different? Well, the offerings. Medigap policies are offered by private companies. So are Medicare Advantage plans. Government oversight with Medigap policies. They are regulated by the state, but they must also follow federal laws. The Medicare Advantage plans are overseen on a federal basis, and plans must be approved by Medicare before they're offered. Medigap policies work with original Medicare. With Medicare Advantage plans, well, they are your Medicare. The coverage with Medigap policies, they help with gaps in original Medicare coverage like deductibles, coinsurance, and copayments, depending upon the plan type that you take, and is covered if Medicare approves that service. Medicare Advantage plans, well, all Part A and Part B covered services and supplies are there. They may also cover things not covered by original Medicare like vision and dental coverage, and most Medicare Advantage plans integrate in the Medicare drug coverage as part of it. Medigap policies do require the individual to have Medicare Part A and Part B, as do Medicare Advantage plans. You got to have Part A and Part B with either option. Do you pay premiums? With Medigap policies, yes. You pay a premium for the policy and you pay your Part B premium. That premium can vary. Medicare Advantage plans, yes, you pay a premium. In most cases, you pay the Part B premium and you may pay a premium for the plan itself. There are other Medicare health plans that are out there that aren't as widely available or as widely popular. Medicare cost plans, these can an individual can join if you only have Part B. If you have Part A and Part B and go to a non-network provider, well, those services are covered by original Medicare, and you pay the Part A and Part B coinsurance deductible like you were just on original Medicare. You can join anytime the plan accepts new members, so those enrollment periods for Medicare Advantage and prescription drug plans do not apply. You can leave anytime and return to original Medicare. You can get either your Medicare drug coverage from the cost plan if they offer it, or join an independent Medicare drug plan, a standalone PDP program. Before I leave that, I need to note that these are not widely available across the country. If you're in a more urban area, chances are there's not one available. Other types of coverage, well, programs for the all-inclusive care for the elderly, PACE plans. These are programs that an individual can qualify for if they meet these conditions. You're 55 or older, live in a service area of that PACE organization, you're certified as the state by needing a nursing home level of care at your home. And at the time you join, you're able to live safely in the community with the help of PACE services. It covers all Medicare and Medicaid covered care and services. And if you have Medicaid, you won't have to pay a monthly premium for the long-term care portion of the benefit. If you have Medicare but not Medicaid, you'll be charged a monthly premium to cover the long-term care portion of the benefits and a premium for the Part B drugs. Let's move beyond plan types for original Medicare and discuss how Medicare and the health insurance marketplace interact or don't. With Medicare in the marketplace, it's against the law for someone who knows that you have Medicare to sell you a marketplace plan, even if you only have Medicare Part A, the hospital coverage, or Part B, the medical coverage, except through small business health options programs, SHOP, if you're an active worker or dependent of an active worker. The size of the employer depends on who pays first, and no late enrollment period if you enroll anytime you have SHOP coverage within 8 months of losing that coverage. SHOP plans are available through issuers, agents, brokers, not through healthcare.gov. A big difference. You can keep a marketplace plan after your Medicare coverage begins. Once your Part A coverage starts, however, you will not be eligible for any premium tax credits or the cost savings you may be getting on your marketplace plan. You'll have to pay full price for that marketplace plan and may have to pay back some or all of the premium tax credits you've enjoyed in the past. You need to sign up with these programs on this for Medicare during your IEP, so that 7-month period, remember that. If you miss your IEP, you have to wait for that general enrollment period, the GEP, where you put in the application through the first 3 months of the year, and the coverage begins July 1st for your Medicare. You may qualify for Medicare based on a disability, and this is important to note. I mentioned earlier that 15% of the people on Medicare are accessing that care because of a disability. They're under 65. To do that, you must be getting Social Security disability insurance benefits for 24 months. And on the 25th month, you're automatically enrolled in Part A and Part B. If you're getting SSDI, you can get a marketplace plan to cover you during that 24-month waiting period. And you may qualify for premium tax credits and reduced cost sharing until the Medicare coverage starts. You can choose a marketplace plan instead of Medicare if you are paying a premium for Part A. You can drop your Part A and Part B coverage and get a marketplace plan instead. You got to do a little financial analysis on that. Or if you only have Part B and you have to pay a premium for Part A, you can drop Part B and get a marketplace plan instead. Or if you're eligible for Medicare but haven't enrolled in it because you would have to pay a premium for Part A, you have a medical condition that qualifies you for Medicare, like end-stage renal disease, ESRD, but haven't applied for the Medicare coverage yet, or if you're in that 24-month disability waiting period. We talk a lot about paying a premium for Medicare Part A. The vast majority of people on Medicare do not. Some things that are important to note as well with the special enrollment period, the overview and background of this. Well, the American Rescue Act, the ARP Act of 2021, was signed into law on March 11th of 2021, and it expands the eligibility for financial help through the health insurance marketplace. It increases the financial health amounts for plans years 21 and 22. This special election period is due to the COVID-19 emergency, which started on April 1st, and then in the eyes of the government ends on October 15th. You can then use this SEP to enroll in or change plans, or to see if you qualify for Medicaid or the Children's Health Insurance Program, CHIP. Let's look at programs that are available for folks on Medicare that have limited income and resources. There are a couple of different programs that come into play. The Medicare Savings program is a program where you get help from your state paying Medicare costs, including Medicare premiums, deductibles, co-insurance, and co-payments. Extra help, sometimes referred to as LIS or low-income subsidy, helps with the Part D drug cost, not the medical cost, the drug cost. Medicaid is a federal state insurance program based on financial need. The Children's Health Insurance Program, CHIP, covers uninsured children up to 19 and may cover pregnant women as well if the family's income is too high for Medicaid. The dollars that are involved here, keep in mind for the Medicare Savings programs, the individual has to qualify based on both income and assets. 4 different programs are available. The QMBs, the Qualified Medicare Beneficiaries, QMBs. As an individual, you have a limit. As a couple, you have a limit. This does cover Part A and Part B premiums and any other cost sharing like deductibles, co-insurance, and co-payments. This is the level of assistance that's necessary to get full benefit out of a Medicare Advantage dual special needs plan as well. You also have the specified low-income Medicare beneficiary, the SLIM-B, which goes up to 115% of federal poverty level, different amounts for the individual and the couple. It covers the Part B premiums only, so the medical costs are still the responsibility of the beneficiary. There is also a qualified individual Medicare Savings program, higher amounts of income for both an individual and a couple. It too covers Part B premiums only. And there is the qualifying disabled and working individuals QDWI benefit, which is for the disabled looking to go back for work. Much higher limits. It covers Part A premiums only. It's important to note that in each of these circumstances, there are resource limits, assets tests for QMB, SLIM-B, and QI, and they vary for an individual and a married couple, and the resource limits for QDWI are much lower, and that's important to take into account. What is extra help? LIS, low income subsidy. It's a program to help people pay with Medicare drug costs, Part D programs, and as I mentioned, is also called low income subsidy or LIS. You have to have the lowest income and resources. If you have the lowest income and resources, you don't pay any premiums or deductible with small or no co-payments, depending upon your eligibility structure. If you have slightly higher income under this program and you have slightly higher resources, you may pay a reduced deductible and a little more out of pocket. It takes care of the coverage gap or late enrollment penalty if you qualify for this extra help, and it creates a special enrollment period, an SEP, which allows you to change your Medicare plan, drug plan, that PDP, once per quarter in the first 3 quarters of the year. If you want to change plans in the 4th quarter, you got to use the open enrollment period, the OEP 8/AEP program. Keep in mind, this goes up to 150% of federal poverty level, where these programs with the Medicare Savings programs, the highest level with the QI goes up to 135% of federal poverty level. So more people will be eligible for extra help than they would be for the MSP. To qualify for this, well, you automatically qualify for extra help if you have full Medicaid coverage or supplemental security income, SSI, or help from Medicaid paying the Medicare premiums, the Medicare Savings programs, and some of these may be a partial dual circumstance. For folks that don't get it automatically, well, they got to apply. You can do it online at Social Security's website or call Social Security for it. You can get a paper application for it. You can contact the Medicaid office. You can work with a local organization like a SIP to do it. Many of the insurance carriers have social workers and other folks employed to help you get this coverage as well. When we speak to Medicaid, well, what is it? It's a joint federal and state program that helps pay healthcare costs for people with limited income and resources or whose medical expenses exceed their available income and resources. These are people that may qualify for Medicare and Medicaid. It may cover services that Medicare may not or may partially cover, like nursing home care, personal care, and home and community-based services. It covers, well, in 2020, covered over 77 million people in our country. To qualify for it, well, they can vary from state to state. Some states will have different income and resource requirements. Some may not have a resource requirement. Well, the MSPs, that's the way. With Medicaid, you will. You need to call your state medical assistance Medicaid office for more information to see if you qualify and how to apply. or you can go to the website, medicare.gov, talk to someone, or call Medicare and get information that way as well. How is Medicare and Medicaid different? A bit of confusion on this for a lot of people. Medicare is a national program that's consistent across the country. Medicaid, these are statewide programs that can vary from state to state. Medicare is administered by the federal government. Medicaid is administered by state governments within federal rules. So you have federal and state partnership. Medicare is health insurance for people 65 or older, people under 65 with certain disabilities, or any age for folks with end-stage renal disease, ESRD. Medicaid, no age requirement. It's health insurance for people based on need, financial and non-financial requirements. Medicare is the nation's primary payer of inpatient hospital services to the disabled, elderly, and people with ESRD. Medicaid, that's the nation's primary public payer of acute health care, mental health, and long-term care services. So different animals. What is CHIP? The Children's Health Insurance Program. This is health coverage for uninsured children in families earning too much to qualify for Medicaid, but too little to pay for health insurance through private companies. It's jointly funded by federal and state governments. It's administered by the states. 6.7 million people were enrolled in the program in 2020. For CHIP information by state, you can visit the website listed here. Helpful websites, Medicare.gov for Medicare, Medicaid.gov for Medicaid, SocialSecurity.gov for Social Security, Healthcare.gov for Health Insurance Marketplace, Children's Health Insurance Program, InsureKidsNow.gov, and you have the CMS National Training Program, the Centers for Medicare and Medicaid Services, that provided this PowerPoint, this presentation at cmsnationaltrainingprogram.cms.gov. And you do also have resources through SHIP, ShipTACenter.org organization, all logical websites. Key points to remember: Medicare is a health insurance program. Medicare doesn't cover all your healthcare needs or costs. You have choices as to how you get coverage, and those decisions will affect the coverage you get. Certain decisions are time sensitive, and there are programs for people with limited income and resources. This is a world that is filled with acronyms. Here's some samples. You do have a link here to an acronym guide provided to us by the Medicare Learning Center that will help you with all the acronyms that are involved. It's important for us on an ongoing basis to stay connected to resources and information made available to us. So you have the information available on the CMS National Training Program that I mentioned. You can subscribe to the email list, and they'll kick you out information on a regular basis. I really enjoy their publications. You can also contact that organization at training@cms.hhs.gov. You can reach out to us too as well at Premier Marketing. And these are programs that are available to you to be comfortable with the different types of programs that are out there and look at things on a vast array that may go beyond just traditional Medicare coverages. So our website at premiersmi.com has a page on tools to view additional material and get you information on how to subscribe to our email list. And you can also go directly to this link for those tools as well. You know, of course, call us 1-800-365-8208. So all that said and done, a long presentation. We appreciate your patience and your understanding while viewing this presentation, and we look forward to visiting with you in the future with any questions you may have and in any way that we can help you. Keep in mind that Premier Marketing is not connected as a government entity. We are contracted with insurance companies to deliver programs to help cover some of the shortfall of coverages with traditional Medicare. Important to note that, and I need to make certain that you understand that. All that said and done, We look forward to conversations in the future, and until we do so, we wish you the best. Thanks so very much. Talk to you soon.